Hi, I'm Ken Tanabe. I have the privilege of serving as the president of the Society of Surgical Oncology. Today, I have Dr. O'Donoghue with us, and Dr. O'Donoghue is the vice chair of the Quality Committee, and the Quality Committee has been super busy and doing a lot of great things, and so I thought she would be a great guest to have, and we can learn a little bit about what's going on. So first of all, Dr. O'Donoghue, can you go ahead and introduce yourself?
Sure. Thank you so much for having me. My name is Cristina O'Donoghue. I'm a surgical oncologist at the University of Chicago. And as you said, I've had the privilege of serving on the quality committee these past 2 years.
But that committee has been really busy. One thing is there's a lot of excitement around choosing wisely. But in the same breath, even though there's a lot of excitement around it, yeah, some people haven't even heard about it. So, can you talk a little about choosing wisely to educate our membership?
Sure. So the Choosing Wisely campaign is aimed to foster meaningful conversations between clinicians and patients about particularly avoiding unnecessary tests, treatments, and procedures, but can just be a starting place for doctors and patients to be able to have decisions around the tests that are being ordered or procedures that are being done. It's centered on delivering high quality care and also that ordering more tests, more labs, more procedures are not always better. And so it's a great starting place for patients and physicians to have conversations. It was initially, the campaign was initially started by the American Board of Internal Medicine Foundation in 2012. And the ABIM reached out to other organizations to partner in creating choosing wisely recommendations for that would be applicable for other organizations. The SSO actually first became involved in this campaign in 2016, but at that time we were limited to 5 recommendations. And then we updated it in 2020, but have not revisited the Choosing Wisely campaign or those recommendations since 2020. And so the it's been a minute since we have looked at these recommendations. And so the quality committee decided it was a good time to reinvigorate this work. The ABIM in 2023 decided that it would no longer necessarily own these Choosing Wisely recommendations and enabled the other organizations that had published their recommendations to be able to sort of take over and monitor their recommendations. So the SSO thought this was a great opportunity. The quality committee discussed being able to reinvigorate these efforts. And so we decided to bring back the Choosing Wisely campaign to the SSO and then actually to double down and not limit it to 5 recommendations and broaden uh, how we would move forward.
Terrific. So, give me an idea of one of the recommendations that perhaps you've recently updated or not, but that you're excited about.
Sure. So I'll start a little bit. A lot of surgeons were initially introduced to the Choosing Wisely campaign about 10 years ago with breast cancer. It seems like different breast cancer organizations became very involved around it. So the SSO and the ASBRS together had similar recommendations of not doing a sentinel lymph node biopsy on patients who are over 70 who had low risk breast cancers. And so, another Choosing Wisely recommendation that it is moving forward from our breast disease site working group is now there's more data and research around sentinel lymph node biopsies for low risk cancers for all ages. And so, expanding the recommendation to not necessarily do the procedure of a sentinel lymph node biopsy on all women who have these low risk breast cancers. And it is not a Again, it's not a definitive statement that for all surgeons you have to follow this recommendation, but it enables a conversation between a patient, a physician, and then also the multidisciplinary group taking care of these patients to open the conversation of if, for instance, this sentinel lymph node biopsy, if information from that procedure would help dictate adjuvant treatment or if it's an unnecessary procedure. And so these choosing wisely recommendations also just enable more conversations around the value of certain procedures and whether they need to be done or not.
Yeah, terrific. So some of this work is being updated. And where do our members go to find this information now?
Yeah, so we're currently in the call for updates. So we have reached out to the different disease site working groups, and the enthusiasm has been excellent. Some groups have submitted 7 recommendations, and each, and so we are currently going through these recommendations uh, and sorting through them. There's a procedure that we have that will ultimately have likely 1 to 3 recommendations from each disease site working group. And then the website, the SSO website, will have these finalized recommendations for 2026. We are going to also write a manuscript to talk about the updates and what's changing with choosing wisely. And then every year, we're going to rotate in updating these recommendations with half of the disease site working group. So on the website, you'll see the previous recommendations. We'll make sure that they're always up to date. The quality committee has a plan of reviewing these annually to make sure as research and data changes that these are continually up to date, but then each disease site working group can move forward more recommendations. So currently we have 5 that are on the website from 2020. They're still applicable, but we will start having more this year by the end of this year.
Well, it sounds like the disease site work groups have really stepped up to the plate. And if you said some of them came forward with like 7 new topics, that's terrific. They have a lot of work on their plate too. I mean, we're all real appreciative of all the effort they put into everything. So it's good to hear
For
that,
sure.
the quality committee and each of the disease site work groups are working together closely. So
Yes, it's exciting to see the enthusiasm. I think that a lot of the disease site working groups and just surgical oncologists are excited to bring forward points around the value of healthcare and how we can improve the quality of healthcare for our patients. We all know as surgical oncologists that ordering more images, more tests, more labs doesn't necessarily equal better care. And so I think it's a great place for us to refer to when we're having conversations, not only with our patients, but also with our colleagues in being able to say that perhaps some of the HPB recommendations, for instance, are around endoscopy and procedures around that. So, a place to point and start conversation with some of our colleagues. So, I think there's a lot of enthusiasm because we all care about the quality of care for our patients and think about the value of care that we're delivering. And so, that's where I think a lot of the excitement came from.
yeah, terrific. That's really terrific. The SSO has a pretty broad membership, resident, early career, mature practices. And so, maybe can you give some hints on how choosing wisely can be leveraged, incorporated, sort of regardless of stage of career, or maybe different stages of career will use it differently?
Yes, I think that it's a reference point for all stages of career. However, I think for each stage, there can be unique opportunities. So for residents, I think it's a great source of information because sometimes the attendings that may be training you may not be as up to date on sort of the value of certain procedures or care. And so it's also a good reference point, as we know that some of the data shows when there is an update in recommended treatments, there can be over 15 years to adopt some of those changes. And so hopefully this can help accelerate some of that. And so um, for everyone in their career to look to it, but for residents to see some of this information on the website. For mid-career, I think that it's a great place, as I said, to talk with our multidisciplinary team. Also, many of us are taking care of patients that are uh, cared for in the community as well as academic centers. And in this mix of taking care of patients around their cancer care, it also can be a good starting point for conversation. And then late career, I think as we are, it's also a great place to get updated information. And what I'm excited to see, our first batch of Choosing Wisely recommendations are around a lot of standard procedures and labs and imaging. But I wouldn't be surprised as we move forward and as technology advances, as molecular testing advances, et cetera, that we start moving forward and thinking about the value of care of these new different tests and how helpful they are or not. As you know, for instance, the Melanoma Disease Site Working Group moved forward a consensus statement around GEP testing. And so, though that's not one of our Choosing Wisely recommendations, I wouldn't be surprised in the future if GEP testing in multiple different cancer sites comes forward to say, what's the value of that, of a test like that? And so I think that that's as oncology care becomes more sophisticated, as new technologies are brought forward, it's also a great place to say, what's the value in taking care of our patients?
Yeah, that's terrific. And I think having the disease site work groups really dive deep into these to, from a science perspective, understand what value it does or doesn't bring, what does the science show, is really key. A lot of our members, everybody just doesn't have time to keep up with everything. And so I think this is a great benefit for our members to be able to offer this. Um,
Absolutely. And I think it's very accessible in that it's bulleted with the recommendations. However, and the references are there, but it's not, you don't have to read an entire manuscript to get sort of the heart of the argument. And so I think it's very accessible for everyone.
Dr. O'Donoghue, that is fantastic. Your committee has been so amazingly busy and so amazingly successful. You've done such a great job that we've recruited you for this new task force that's being launched, the Advocacy Task Force. So, first of all, thank you very much for doing that. And do you want to make a few comments about the Advocacy Task Force for our members?
Yes, we're very excited to move forward with the SSO Advocacy Committee. As you know, there's just so many different opportunities that as surgical oncologists, we can advocate for our patients and for our research and for ourselves. And so this task force has gathered a great group of surgical oncologists to help move forward what the our first steps will be, and then also to partner with other organizations that are already working in this in advocacy and policy. And so more to come on that.
All right, awesome. Thank you very much, Dr. O'Donoghue. So much going on in your world there. I'm really appreciative that we had the opportunity to chat today.
Thank you so much for the invitation.
All right, you have a good evening.
You too.